I had been in academia for quite a while, and I loved the impact that I made on our profession over the years and all of the students that graduated and staying in touch with them and seeing them grow. That's been so rewarding. What I wanted to transition to industry for was the ability to have an impact on a greater number of people in our field. And being at the Mopec in the position I'm in well positions me to be able to help have an impact on those in our field and improve their daily lives through the products and solutions that we can offer.
Welcome to the People of Pathology podcast. I'm Dennis Strenk. On this podcast, we explore pathology one story at a time and connect with the people behind the diagnosis. What happens when we apply new technology to standard practices? Today, my guest is Roseann Vitale. Roseann is a product manager at Mopec, where she helps guide product development by representing the voice of the customer. We'll talk about her journey into pathology, her work in both educational and clinical settings. We'll also discuss the future of grossing, the role of technology in standardization, and the Mopec Clinical Advisory Board. All right, here's Roseann Vitale. Welcome to the show. I'm glad we finally made this happen.
Yes, me too. Thank you so much for having me.
You and we've known each other for a long time, but I was thinking, I don't really know I don't think I've ever heard this story of how you discovered the PA profession. Can you tell me that story?
Oh, of course. I was taking my prerequisite courses for graduate school and had thought about physician assistant, maybe looking at nurse practitioner, etc. And while I was taking one of those courses, a study buddy of mine knew a pathologist assistant, and she knew about my creative art background. My undergrad is from the School of the Art Institute of Chicago.
Okay.
I have a Bachelor of Fine Arts from there. And she knew about my creative background, my passion for patient care and interest in disease. And at that time, it was a perfect combination of passion for pathology and disease state in people and helping someone from behind the scenes and being able to apply my visual and spatial reasoning in that space.
Oh, sure, because that carries over from your art training, the visual and spatial reasoning, which is very important in what we do.
Right. It was one of my probably first learnings when I started teaching was that not everybody can visualize things the same way. If you're talking about a specimen that can be really hard to picture, such as a laryngectomy or even something as simple skin, understanding the margins on something like that can be challenging for learners when they're reading about it in a book and they're not seeing it in front of them.
All right, so you applied for the PA program. You got accepted, obviously. And did you ever, while you were, I guess at the beginning of that, or even while you were going along, did you immediately think, this is perfect for me? This is exactly what I want to do? Or was there any doubt about that?
I didn't necessarily feel the doubt, but I definitely recognized while I was in my clinicals that I had a passion for communicating what we do
Okay.
to other people and the importance of what we do, and that other people could be other healthcare professionals, non-healthcare professionals like friends
Mhm.
that are also patients, and then subsequently new learners and students.
Okay. And was it that aspect then that led you to get into teaching at Rosalind Franklin?
Yep. While I was in my second year of clinicals, I had expressed an interest in teaching pretty quickly to my faculty at Rosalind Franklin. And during that time, there was some transition happening of faculty moving out of state, and it worked out. And I was able to do a trial period during my second year where I was able to go and spend a week, do a lecture, help out with lab, and get a sense for the whole process.
Okay. That's interesting. And then you ended up spending more than a decade there at Rosalind Franklin teaching. I want to talk about one aspect of that in particular. You helped to build and lead a simulated pathology lab for the PA students. Tell me about this. How did you develop this program?
Yes, Rosalind Franklin, during the first year, it's a didactic portion of the PA education. And their first year, they're taking all of their courses, written exams, and then in the second year is their clinicals. And I was the director of experiential learning, and my role was to take any didactic coursework that we were doing and then creating psychomotor objectives for the first year students and creating opportunities for them to practice and fulfill those objectives for their education. When students are learning in the first year of the PA program, we're really focusing on even the most basic of skills. And that can include simply serially sectioning something and doing that well. Additionally, safety was one of the most important things that we started with, even teaching students how to put a blade on a handle, how to take those off. Those were all part of their psychomotor exams. Not only was there the laboratory component where they got to practice the hands-on process with animal organs or other recreated surgical specimens, they had the opportunity to then get assessed on things like their safety, being able to dictate a simple biopsy, measurement, etc.
Okay. I think the safety aspect that you just mentioned, I don't think that's given enough attention. As someone who in the past has cut himself up quite a few times, when I'm teaching someone or even just have someone shadowing me, I like to point out the safety aspect and always know where your blade is and don't get your fingers too close to it and things like that.
Yes, and the students were also assessed every lab on safety.
Oh,
So
okay.
if they had issues with, I would always say, forceps, not fingers.
Yeah.
It's not fingers. I didn't want them cutting themselves. Usually be a gentle reminder. So that would be something that we took into account as part of their overall grade in lab.
Okay. Can you tell me about some of the ways that you simulated lesions in these? They were animal organs, right?
Correct. And so what I did over the years, I sort of learned which animals have the most representative organs for human anatomy.
Okay.
For example, a pig's spleen was a little too long and skinny versus a sheep's spleen was more similar to a human.
Oh,
So,
didn't know that.
right? You wouldn't think.
Yeah.
And so what I would do is I would order them from a slaughterhouse, and then when they came, I would dissect them so that they were as similar to what you would receive from a surgeon as possible, with like the margins and where things were cut. And so once we did that, the epithelial lesion, I have to give credit to Matt Guerin because this was his idea as far as the epithelial lesions. He had the idea to take a torch.
Oh,
Yeah, a kitchen torch, and gently point it towards whatever part of it works best for epithelial lesions, sheep esophagus
okay.
and pig skin for skin of lips. So that allowed us to standardize the assessments as well. So then for exams, the students would have a similarly dissected organ and then similarly placed lesion. And so then the assessment would be based on the approximate size of the lesion that we created. How many sections did they submit? Did they submit their sections to the appropriate margins? Is it embedded appropriately? And then they would also get assessed on the section thickness. So if the section was too thick, then they would lose points on their section as well. So then after we did the epithelial lesion creation, we realized that we needed a solution for solid lesions
Oh, sure.
because explaining to a student how to measure something in 3 dimensions, a tumor between slices on normal tissue, is difficult. They're taking these slices, putting them back together, but there's no tumor there. So they're trying to visualize where the sections are, for example, in a liver or in a lung. relation to airway, relation to pleura. We utilized gelatin and pectin mixture into pig lungs as a solution, and then it became firm lesion within the lung parenchyma. And our team published a poster about this at the AAPA conference in 2023 in Baltimore. And so I've talked a lot about my contributions to the simulated anatomic pathology laboratory. However, all of this was done within a fantastic team there at the university. And so this was very much a collaborative effort, and we all contributed to the success of this program.
That sounds very useful. Now, during the time you were teaching at Rosalind Franklin, you also were working per diem in pediatric pathology. And I wonder, how did it, still having one foot in the clinical aspect and then one foot in academics, how did that shape your, I guess, your overall perspective and maybe your teaching perspective too?
Yeah, so at the time I started doing the per diem work at Children's, I also had just had my first child,
Oh,
and adult surgical pathology has very many rewards, knowing that you're helping people on a daily basis. One of the most certainly rewarding parts of working in pediatric pathology is knowing that you're not only triaging delicate, fresh tissue that needs to be allocated for multiple special studies, you are helping ensure an accurate diagnosis for a child, and then knowing what the impact of that does to the caregivers of that child and the clinical team is really impactful and rewarding. I also recognized that there were a few things that perhaps were absent from, at the time, some of this was before grossing guidelines were out all the way, a standardized textbook or data as to how to guide these pediatric specimens. And so that also prompted my interest in working as a section author for the grossing guidelines. So it not only guided my career as far as scholarly work later on, but it also provided me additional resources to bring back to my program and back to the students. I recognize the importance of testing not only our aseptic technique, for example, in our micro setting, but let's now consider maybe a lymph node and how that would be triaged, and utilizing tools that mimic what the students would see in their clinical year. So making sure we had sterile petri dishes or things like that would be similar to some of the unique specimens we'd receive from like interventional radiology, etc. So I was really grateful to take that opportunity and bring it back and provide additional value to the students.
okay. Again, good lessons for your students.
Thank you.
Now then, after years of in working in education and then clinical work, you made the jump to industry and joined Mopec as the product manager. And I think this was a little over a year ago now, right?
Correct. I started at Mopec in June of 2024.
Okay. Okay. What was the motivation to make that jump?
I had been in academia for quite a while, and I loved the impact that I made on our profession over the years, and all of the students that graduated and staying in touch with them and seeing them grow. That's been so rewarding. What I wanted to transition to industry for was the ability to have an impact on a greater number of people in our field.
Okay.
And being at the Mopec in the position I'm in well positions me to be able to help have an impact on those in our field and improve their daily lives through the products and solutions that we can offer. As far as my transition into industry, I knew I wanted to make the transition, but communicating your value as a PA to corporate entities can be a challenge. And so I actually worked with a career coach to do that. And he really helped me take my experience as a PA and educator and transition them into actionable items that create impact. If any PA out there is considering making a transition to industry, one, if you can hire a career coach, that can be great. There's a lot of individuals out there that help people who want to make a transition into industry. But then think of some of the efficiencies you've done in a lab, or think about ways that you've improved a process and translate that into some sort of outcome.
I like that a lot. I know there's probably a lot of PAs out there that think they could give some value to industry, but don't know how to go about it. So I think that's really good advice.
And we do have a lot of value
Yeah.
for our industry, especially in pathology, because we understand the importance of cancer staging, protocol, regulatory issues that are unique to pathology laboratories. And we can bring that value and insight to many different companies within our field.
Okay. I like that a lot. That's great advice. Your role at Mopec, I guess, from my understanding anyway, it's about being the voice of the customer, right? Because you've had that experience, so much experience of being a PA, and now you can, I guess, speak for us and speak for the pathologists and our needs to the company. What does this look like in practice? I wonder, maybe there can be some examples or something like that.
Well, thank you for saying that. And I'd like to also make a point that that is not a role that I take lightly.
Okay.
And if anyone knows me, they know that I know when to ask questions
Mhm.
if there's something I don't know about. When it's voice of customer and representing and trying to help our field, I always lean on experts like you, like others in our field when there's topics or questions I might have about ways to improve things. I take the comments, pain points, suggestions, and frustrations of our customers and take those back to our company and work on finding solutions. And it's not always a one-to-one. It might not be immediately solved like for that person perfectly, but what it does is shape our strategy and our approach to handling problems and ensuring that when we're developing new products and solutions, those pain points are addressed.
I mean, that makes sense. The best way to improve products that we use in our field every day is really to talk to the people that are using them.
Absolutely. And that's why having individuals like you on our advisory board is so fundamental to bringing that to our company and our profession. One of my favorite things that I do at Mopec is help with new product development and the rationalization of our product line. Custom is our standard, used to be a tagline at Mopec.
Yeah.
And what that resulted in is a very extensive collection of parts and equipment that we made. And sometimes it was, we're listening to the voice of the customer, but maybe it's just this one customer and they just have this one specific need that we were meeting. I think what's so important about my role is I can help take that voice of customer from a global sense as far as what makes sense for the majority of people that are doing an autopsy. If we can meet the needs of 80% of our customers with this solution, and we can offer configurable options that can be altered slightly, but aren't necessarily a whole new product, whole new custom product, then we're doing the right thing.
That makes sense. It's more standardized, is what you're saying.
Exactly. Looking at our product line, looking at offerings that we've had that are very similar, let's take the best of each of those and put them together. Or maybe we already have one product that does that for us.
And then I would assume then it's going to be, you're talking less expensive, and probably you can get the product faster.
For manufacturing, it definitely helps improve quality to have a standardized product line and efficiency as well.
One of your main projects over the last year, you started the Mopec Clinical Advisory Board, and I'm part of it. And thank you for inviting me to that. It's been very interesting so far. But can you take me back to the beginning of that idea? Where did that come from, and how did you make this happen?
Thank you so much for being on our advisory board. We are so grateful to have you and your expertise. You speak to many different experts in our field. So having you on our advisory board is having all of those experts
Mhm.
as well, because you're learning from all of the interviews and conversations that you're having. The idea of the advisory board was to utilize a community of experts during this transition from a stainless steel manufacturing company to a technology driven solutions provider for the entire pathology continuum. Anyone from anatomy to autopsy to surgical pathology, we want to represent them. And the advisory board is composed of individuals with expertise in each of those areas.
Mhm.
So, starting with yourself, surgical pathology in a hospital setting in an academic facility well represents many of our customers. And you also have worked and volunteered for the American Association of Pathologist Assistants. You've been involved in so many different aspects of our field that we have a lot of expertise with you on the board. I won't go into everyone that's on the board, but I'll mention the specialties in general. But
Okay.
we have individuals from CAP, more of an informatics minded individual. We have PAs that are in autopsy pathology roles full time. We have forensic pathologists, other pathologists that are overseeing informatics divisions. We have a wide breadth of individuals representative of our customer base.
Mhm.
And not only that, where we are today and where we see ourselves in the future.
Okay. That it's so we've had a few meetings so far. We've had an in-person meeting just a couple of months ago, and it's been very interesting, the discussions that have come out of this. Are there particular goals that you want to achieve with this advisory board?
Yes, Mopec's clinical advisory board goals are to provide structured clinical feedback, which helps us shape our product roadmaps and our overall strategy. And this helps strengthen Mopec's role as a purpose driven solutions provider in pathology. And we're utilizing expertise from pathologists, PAs such as yourself, those in forensic roles, histotechs, informatics experts, and we utilize that expertise directly into our process, ensuring that our products, services, and workflow solutions reflect real world needs in pathology and forensics. So that means, yes, we're thinking about a lot of future technologies, but in order to get us there, we need to ensure that as we're evolving, we're addressing those pain points in specimen handling, in grossing, and in autopsy workflows. And having this advisory board provides us an opportunity to share insights across our multidisciplinary expertise. And in this process, we have opportunities to look at technologies that are growing in the specimen handling portion of pathology, which is really
Yeah.
exciting. We appreciate the opportunity to utilize this expertise for developing priorities when it comes to our new product development and look forward to building a platform that supports patient safety, user safety, and ultimately diagnostic accuracy. So, this input from our advisory board really helps fulfill Mopec's mission, vision, and purpose to enrich life by building the platform that transforms the treatment of disease.
Okay. I like this idea a lot, and like I said, I'm enjoying being a part of it. But it's very forward thinking. I know of a few other companies who are starting to utilize customer advisory boards, and it's helping them refine their products and advance their products, really. So I like the idea that Mopec has gotten on board with this way of thinking too. Because as far as the PA field and probably pathology in general, I mean, it would be hard to find a hospital that doesn't have some kind of Mopec product in it. So it's a very influential company in this field. This is the People of Pathology podcast with our guest, Roseann Vitale. We'll be right back. When it comes to cancer staging, one of the most important parts is finding all of the lymph nodes. I should know, it's what I do every day. Yet this process has remained the same for over 100 years, manual, tedious, and time-consuming. That's a problem, because every missed lymph node can mean inaccurate cancer staging. That's about to change. Enter InVision from Cision Vision, a first-of-its-kind device that's redefining the standard of care. Traditionally, we identify lymph nodes by sight and feel alone. InVision changes that using short-wave infrared technology to make lymph nodes stand out clearly from surrounding fat and in real time. In its first 104-patient study published in the Journal of Clinical Pathology, InVision helped increase lymph node counts in 86% of cases and even upstaged 4% of patients from N0 to N1. I personally contributed to the study, and let me tell you, seeing the technology's impact firsthand was amazing. It's time to invest in grossing innovations that improve patient care. So, how is your lab approaching innovation in grossing? Book a demo at demo.cisionvision.com and start seeing lymph nodes like never before. Are you thinking about applying to a pathologist assistance program and feeling a little lost? That's why I created the Path to Path A, your PA school application blueprint. This is a step-by-step prep course that gives you everything you need for a strong application. From finding shadowing to writing a standout personal statement to prepping for interviews, this course was made to help you feel informed, confident, and ready. Visit www.thepathtopatha.com to join the mailing list. You'll be the first to hear when the course launches. Your path starts here. And now for the rest of my conversation with Roseann Vitale on the People of Pathology podcast. You mentioned the technology aspect, and I want to touch on that a little bit as far as digital pathology. So much of the focus in digital pathology has been on the microscopic aspect, right? The slide. And you've talked about the importance of standardizing the upstream process, right? The grossing process. What challenges do you see there, and how can technology help to address them?
That is correct. I have been to many digital shows in the past year that I've been at Mopec, and you're right, a lot of the emphasis is downstream. However, how that information gets to the pathologist is largely still a manual, hands-on, and at times highly subjective process that really hasn't had much technology integrated with over the last 100 years. It's been largely the same. Thankfully, standardization through tools, the American Association of Pathologist Assistants grossing guidelines have offered some standardization in this field. However, up until those were created, much of our resources were textbooks that had been not updated in recent history, and we were left with oftentimes personal preferences of individual facilities or even within one hospital system. So there's definitely a need, and I think we're asking a lot of pathologist assistants and pathology residents and anyone handling patient tissue. Their role in the diagnosis of disease is so instrumental, yet the tools that we are provided are not the most technologically advanced.
Right.
Other areas of subjectivity I see within grossing include even something simple measuring. When I was teaching, I started using measurement as an assessment piece in my exams. And what I noticed was that the answers that the students gave were all over the place, especially in the beginning. And it was because they were all holding their ruler slightly differently on the same piece of tissue. As far as the greatest access, where they were placing their ruler, etc., could vary. They were saying the right number, but it wasn't necessarily the greatest dimension, for example.
Okay.
And so I started realizing that while I know they got better towards the end of the year, and I know that during their clinicals they were assisted and watched over to make sure that the measurements were accurate, it just made me realize that we could be doing better for ourselves and for our patients. We can have more technology that can help us with accurate measurements, understanding different tissue types, whether it's fibrous tissue or a tumor. Is it desmoplasia? Is it a capsule of a tumor? Is it actually tumor? All of those things are learned through visual practice and time and experience. However, there's not a lot of technology in this space to help us
Right.
in that way. And we already know we're limited by our visual field. That's why we use specimen radiographs to find clips in breast tissue. I would love a world where a pathologist assistant or resident could take a bone tumor and know exactly where to cut it for the greatest dimension.
Yeah.
I remember looking at patient radiographs, looking at the specimen, back at the radiographs, and trying to pinpoint where exactly I would put the bone in the bandsaw to get the greatest dimension. And I thought, has to be a better way what we're doing, especially when it impacts understanding how a patient will do after surgery. So if we know that determining a percentage of necrosis in a bone tumor helps understand that pathway after the surgery, how effective the treatment was, the process to obtain that greatest dimension is pretty manual and lacks technology.
Yeah. I'd love to see some kind of AI application that would determine the greatest dimension and also could estimate like the percentage of necrosis too. But that's probably far in the future.
Right? It does sound like it's far in the future, but my point in bringing some of these ideas up is that there's so much potential to do better for ourselves and for patients.
Okay. I like that. You were talking about variations in measurements, and we've talked about that before. That's an interesting topic. And oftentimes those measurements are very relevant, especially for cancer staging. I'm thinking of breast tumors, for example. That measurement makes a difference, a big difference.
Right. And we know that the pathologist corroborates what we say versus what they see under the microscope. So there is a check with the pathologist,
That's true.
but there's a lot of subjectivity. That's where it concerns me.
Yeah.
And even thinking of tumors, if you're measuring something fresh or it's been fixed, if a tumor, you measure it, you bivalve a kidney, you measure it, is it 8 centimeters? Is it 8.5? And knowing that cancer staging is based off of formalin fixed
Right.
tissue.
Right. That makes a difference. So then you're talking about bringing technology to grossing. Can we talk about some of those things? What kind of things, I guess, are in the near future?
As of July of 2024, all Encore grossing stations have an integrated camera system, and that comes in the top of the hood with the station. And then there's software that accompanies it. And the software is very simple and allows ease of annotating images of the specimen right at your station. So you don't have to worry about moving your specimen to a photo stand or sharing a digital camera that you have to manually download images from. So no longer will you have to manually print your bone tumor specimen for your cassette grid and then hand draw a cassette grid over it. It's pretty easy to do right at the station. And what I appreciate about it is not only is it hopefully efficient from a workflow perspective, we also know having tools like something as simple as a cassette grid is functional. It's impactful because with, for example, neoadjuvant treated bone, breast, or lung, the percentage of necrosis that's visualized macro and microscopically has an impact on the diagnosis, depending on which tumor type and what the presumed outcome for this patient will be. So, having tools like that integrated into the station help us fulfill our mission, vision, and purpose to enrich life by building a platform that will transform the treatment of disease. Additionally, we have partnered with Lumea to integrate their camera. And Dennis, you were part of some of those early conversations. So thank you for your participation. And so that's a good example of us using the voice of our customer in the development of a product. And so essentially what the camera does is take an image of the tissue in the cassette, it takes a photograph, and then you get measurements of those tissue pieces, which can be pretty easily integrated into medical record. And we know that when it comes to biopsies, we're dealing with irreplaceable diagnostic patient tissue. And not only that, we know that cancer rates are rising every year, which is leading to changes of screening ages. For example, with colon cancer, it went from age 55 to 45. So what that means is changing the testing guidelines also means that there's increased subsequent specimen volume. And we know that from the American Association of Pathologist Assistants that PAs are experiencing burnout and increasing workloads that aren't necessarily associated with supportive staffing in those situations. And when we're dealing with a repetitive processing of a specimen type like a biopsy, it can be prone to error.
So, what about some things maybe that are outside of our control, like the way specimens are received, for example, that can be pretty variable at times?
Sure. And that's definitely, if you're a member of the PA Facebook group, oftentimes some of the pain points PAs will bring up there is how specimens are received, whether it's poorly labeled, not enough formalin, or formalin something that shouldn't have it. But even something like a biopsy, if you think about a prostate biopsy, a lot of times are put in a formalin-filled container with a pad and just a regular pre-filled jar. And so PAs not only have to open 12 containers, a lot of times the biopsies are stuck in the lid. When there's multiple cores in a specimen container, they bump into each other, and that turbulence can lead to increased fragmentation, which is the difference of the number of cores taken at point of care to when we receive them. So if there's a difference there, there's fragmentation. And so now you're not necessarily getting as accurate a picture of the number of cores that are involved with something like a prostate cancer. And so having inaccurate data can lead to improper post-biopsy screening. And so this is a great example with Lumea's consumables on how, we can be advocates for the patient and influence the types of collection systems that our biopsies are received within. So what's really exciting about the biopsy board from Lumea is that it provides not only designated lanes for the prostate on their biopsy board, it has the already pre-labeled anatomic regions for the biopsy. It also allows for the collection of the biopsy in a designated lane so that you can maintain the integrity of the tissue from the point of care to the time it gets to us in pathology. So there's more diagnostic tissue present because it's laid out in that lane. It's pre-labeled, so you have less to worry about subjectivity when handwriting prostate biopsy labels. And you reduce the number of cassettes for your histology. And we already know that histology is facing workforce shortages as well, and they have pretty big retirement coming up. So there's a potential loss of institutional knowledge in that field. So anything we can do to reduce the work burden on our team in pathology and histology also is beneficial to us, because not only are we helping make a difference in patient care and outcomes with additional technologies like these consumables, we're also helping our end users in pathology and histology. That's the future of where we're pointing, and we're really excited to bring along those experts in our field, such as yourselves, that are on our advisory board to help point us in the right direction.
Okay, I like that a lot. That sounds very like a very exciting future. One thing I wanted to ask you about, because you're involved in several professional organizations. We already mentioned the AAPA, also the Digital Pathology Association, the panel of national pathology leaders. All of these roles, how did they influence your work at Mopec?
Earlier, you asked about the influence of working in a pediatric hospital on my career, and what that contributed to is serving as the pediatric section author for the American Association of Pathologist Assistants grossing guidelines. And within that section, I'm also primary author of the Wilms tumor protocol. So having increased access and integration of these resources with any sort of technology is always top of mind for me. And last year, Mopec joined the Digital Pathology Association, and I serve as a non-voting industry member currently on the Digital Pathology Association Advisory Board. And then through that, I began volunteering on the education committee, and I'm currently working with some of the other members on a paper on technology and grossing. So excited to see that move forward. And Dennis, I know you're a member of DPA too,
Yes,
aren't
that's
you?
right. I'm not involved in any committees yet, but I do plan to do that in the future. There certainly are a lot of opportunities.
Absolutely. And we can help our pathologists with utilizing new technologies in our laboratories and help them onboard those things. So that's an additional role that we can continue to contribute our value within our laboratory.
Mm-hmm.
I think there's a lot of collaboration that we can do with our pathologists and assisting them with bringing on digital into our spaces and learning from other labs. But not all of the information that can be done or the technology that's working in digital pathology works for the upstream process, actual specimen handling. Some of it can, but some of it doesn't apply. So I'm excited about us as a profession being able to take the learnings from digital pathology. What did they learn in the decades plus that they've been bringing on digital, and apply those same learnings or altering them so they make sense for grossing and for surgical pathology.
Mm-hmm. Yeah, me too, for sure. Okay, then the last question is, if you look ahead 5 to 10 years, what do you hope that pathology professionals will be saying about the way Mopec has contributed to grossing and to the larger workflow in anatomic pathology and patient care?
I didn't know I needed this technology, but I am so happy that I have it.
Ooh, I like that. That's a great answer. Yeah. Yeah, for sure. Roseann, this has been an interesting conversation. I'm so happy we could finally have some time to catch up a little bit. So, Roseann Vitale, thank you very much.
Thank you so much for having me, Dennis. It's been an absolute pleasure.
If you're looking for another episode of the People of Pathology podcast to check out after this one, here's a clip from my interview with Christine McCluskey as she talks about how she created a gross case workshop for educating residents.
And we had no space to host about 30 students that he proposed to bring over. So I put together a presentation for them, and MD Anderson, instead of cases of interest representing the paradigm of benign to malignant disease presentation. So our residents found out and requested that I do it for them. So any teaching cases are cases that I had grossed and the residents had lost that experiential learning because I had grossed the cases and they weren't present or they weren't on that rotation for the month. It was archived as the workshop. So I then introduced microscopic correlation. I collected the evaluations for this. I showed that these presentations increased the knowledge, the comfort level of the residents grossing, and submitted it as a manuscript to the AAMC MedEd portal, which published it as a teaching tool.
You can hear more from Christine McCluskey in episode 93. Okay, so big thanks to Roseann Vitale. I really enjoyed this one, partially because Roseann and I are friends, but also because Rosann's story ties together so many different aspects of pathology, education, clinical practice, and now industry leadership. We started with how she first discovered the pathologist assistant profession and how her background in fine arts gave her a unique perspective on anatomy and pathology. Those visual and spatial skills, the way she could think in 3 dimensions, became a real asset in teaching and in the lab. From there, she walked us through her years at the Rosalind Franklin University Pathologist Assistant Program, where she helped to build a simulated pathology lab for PA students. What stood out to me was the creativity and innovation in that work, how the team designed lesions in animal organs to mimic human pathology, which made training more realistic and standardized. That kind of teaching gave the students a foundation of psychomotor skills and safety practices that prepared them to step confidently into real-world labs. At the same time, Roseann was working per diem in pediatric pathology, which brought another dimension to her experience. She talked about the challenges and delicate nature of those cases and how it influenced the way she taught students. Eventually, Roseann decided to take her experience into industry, and that's what brought her to Mopec. We talked about what it means to be the voice of the customer in her role as product manager, listening to the needs of pathologists, PAs, and lab staff, and then making sure those needs are built into product design and strategy. A big focus of our conversation was the grossing bench itself. While so much of digital pathology has advanced on the microscopic side, Roseann pointed out that grossing, the upstream process that sets the stage for everything that follows, has remained largely unchanged. She's passionate about standardization and using technology to reduce variability and improve diagnostic accuracy right from the start. We also got into the Mopec Clinical Advisory Board, which she helped create. It's a multidisciplinary team that provides guidance on product development and strategy, ensuring that innovation is always connected to real-world needs. That initiative, along with her involvement in organizations like the Digital Pathology Association, the AAPA, and the panel of national pathology leaders, shows how she's working to keep industry, education, and clinical practice in constant dialogue with each other. Rosann's story shows that every skill you learn along the way can be applied in later situations, and with the sum of those skills, you can carve out your own role that can help the greatest number of people. As always, I'll have links in the show notes to everything that we talked about today. Don't forget you can follow this show at People of Path on both Instagram and Twitter, or just connect with me on LinkedIn. Thank you for continuing to share the show with others. Together, let's inspire the next generation of pathologists and laboratory professionals. This show is a member of Health Podcast Network. Thanks for listening. I'm Dennis Strank, and I'll talk to you next time on the People of Pathology podcast.